Good morning, guys. My name is Kelli Porter, and this is Ashlee Eaves, and we're going to talk to you guys about an acetabular labral tear.
So our patient is a 56-year-old male. He's been a truck driver for the past 10 years. On average, he drives 2,500 miles in a week and about 500 miles in one day. In his free time, he enjoys trail riding on horseback. Originally, he had FAI, or femoral acetabular impingement, so where the ball and socket, or the femoral head, is rubbing in the acetabulum. Over time, this can lead to little micro tears, and ultimately, for our patient, it led to a labral tear. Okay, so this is our coxal bone, and in here is our acetabulum. It's basically the socket portion of our ball and socket joint. Within the acetabulum is our labrum. It lays right in here. It's made of fibrous connective tissue, and it actually has two different zones. The extra-articular zone is adjacent to the joint capsule, so it receives nutrients and adequate blood flow, whereas the intra-articular zone is next to the bone and the articular cartilage, so it may take a little bit longer to heal because it's more avascular. Some concerns for our patient is going to be pain, joint stiffness, loss of function, abnormal gait, and some personal concerns, both his job, so as he's a truck driver and on horseback, he's pretty sedentary. He might have a little bit more discomfort in his hips and joint stiffness. So we want to look out for popping, clicking in his hip joint, decreased range of motion, and also overcompensation with gait.
And for our patient, we chose to do the operative treatment. Based on his age, he is the older population, the older age, he's kind of old a little bit. He is also a truck driver, so he does sit a lot, which causes a lot of friction, kind of maybe getting up and down or trying to get comfortable. He's doing a lot of movement with that hip joint. So we chose to do the operative treatment based on the long-term effects that it has. So he'll have less pain and more increased range of motion and things like that as he gets older in age. We chose not to go with a non-operative because it is a little bit more of an aggressive treatment, which is probably a little bit too more aggressive for him based on his age. And they start off doing like a lot of stabilization and a lot of joint moves those first two phases, which is probably a little too aggressive for him considering he is of 56 years. And they also go into, muscle strengthening. They move really quickly. You only have about 9 to 13 weeks to progress and kind of get that labrum to heal.
All right, our first phase is our inactive phase. We're going to focus on decreasing joint inflammation through the use of modalities. So we can use RICE to decrease and prevent future swelling, E-stim for pain, possibly muscle re-education if necessary, and also some soft tissue mobilizations or myofascial release for decreasing joint stiffness. Also, we're going to be stabilized. Sorry, excuse me. We're going to be in a non-weight-bearing position. We want to avoid hip flexion over 90 degrees and hip abduction over 25, as Kelly's demonstrating, and we don't want to have really any extension at this point. After 2 weeks, we can start with some passive range of motion in all directions. So flexion, extension, abduction, adduction. I'll demonstrate some internal and external rotation. So we're just going to grab her distal femur and rotate it externally and internally. And so at the beginning, we really don't want a ton of rotation, so I'm not going to let her toe point past around 20 degrees. Thank you. Then we can also start incorporating some isometric contractions to build up our initial strength. With all of our hip musculature, we don't want to forget our core strengthening, so we can do some bridges, some planks as pain tolerates. And also we want to make sure that we preserve range of motion and strength in our knee, ankle, and feet. So we can do knee flexion, extension, ankle pumps elevated to flush out some of that swelling, and also some toe crunches.
In phase 2, we're going to focus more on increasing his muscular strength and endurance. So we want to get into some aquatic therapy, getting him to do some weight shifts. So he's kind of starting to weight bear a little bit on both of those legs and that injured leg. And also have him starting to walk in the water and doing some mini squats and lunges in the water as well. Just to kind of start working those muscles in that area, so that way when we move on to the further phases, we can get into some more aggressive strengthening exercises. And also we want to focus on active range of motion of hip flexion, extension, abduction, adduction, things like that, using a stool. We want to do some joint moves, possibly if need be. Balance, we want to start incorporating some of this balance and proprioception by using, AirX pads or wobble boards, Dynadis, things like that. And then we also want to do some strengthening bridges, knee extensions. And the multifidus hip lift is one thing we're going to demonstrate for you. If I can have you on all fours, please. And what you're going to do is you're going to be on all fours, hands and knees. And what you're going to do is you're going to take that leg and you want to lift it up towards the ceiling as best you can. Also commonly known as the fire hydrant, Ashlee. And just to kind of work on some of the more gluteal muscles to kind of focus those muscles around the hip to keep that strength going and keep him strong. And also incorporating some cardio, getting him on the stationary bike.
Phase 3 is our resistive phase. We're going to work on restoring his full range of motion back to its contralateral limb. Also increase muscular strength and again continue working on the patient's proprioception and balance. We can use the best test to assess his progress along the rehab plan. Also, we want to look out for DOMs. We want to make sure that we're not progressing him too quickly. He's having a lot of pain at home. And also make sure that he has proper form when he's doing his exercises. With aquatic therapy, we can start doing bounds, putting more weight through that limb. He can be jogging forward, backward, even doing like the grapevine and incorporating some multi-directional movements. We can do resistive exercises for really any direction, internal rotation, external flexion, extension. For endurance, we can start incorporating like wall sits, and I'll have Kelli demonstrate some lunges with trunk rotation. To make it a little more challenging, we'll have her do it on an AirX pad. Don't slip.
Yeah, don't slip. Make sure it's on a non-slip surface. Definitely.
Put something so it doesn't move. Yeah. And this is great for our patient because he's going to have to be bending down to pick up things, twisting, keeping stable in his core. We can also do some sumo squats, so like he's squatting down to pick something up, and also step ups and downs. That way, like when he's loading things on and off of his truck or into a warehouse. And for cardio, a stepping machine would be great because he's working on his step ups and working on his endurance.
In phase 4, our final phase, which is also going to be our most aggressive phase as we're trying to get him to return back to work. So we're going to focus more on demonstrating the proper lifting techniques and climbing techniques so that way he's able to efficiently climb in and out of his truck, in and out of the back of the truck. And when lifting, making sure he's properly lifting boxes and things like that. He's loading and unloading, like Ashlee mentioned. Some of the exercises we want to focus on, we want to start getting into some plyometrics, doing some power skips, maybe some ladder drills as well, just to kind of help with those quick movements, moving side to side or having to quickly put something down, maybe put something back, quick stepping, things like that. Also want to do some deep squats. By this time, he should be a little more advanced in his balance, so we're going to make sure we incorporate an AirX pad. So Ashlee's going to demonstrate for you. We want to make sure he's going below at least 90 degrees to get that really good, deep muscular strength and stretch going. And we also, to demonstrate proper lifting, we're going to use a Swiss ball. As he squats, he's going to bend, squat, lift the ball, and then place it back wherever, side to side, right back in front, whatever need be to work that trunk rotation as well. And then some things, we can get him in the pool, we can have him start to swim so that way he's kind of working total body. He's working his arms, his legs, everything, kind of strengthening all over. And we want to make sure that he is in the best shape possible as he gets ready to return to work and things like that. So that is our patient, 56-year-old male with an acetabular labral tear. We hope you guys enjoyed. Thank you.